Greetings, everyone. How are all of you? Yes, I love that energy. The energy in the front. We need all that. All right. I wish I had that myself. There is coffee and snacks and drinks in the other area there, as well as the restroom. Our cultural volunteers, if y'all want to come on in and join the fun as well. Can we have a round of applause for our lovely volunteers? All right, now we'll get to the meat and potatoes of why we're all here today. So good afternoon. Thank you all for being here. And we want to welcome everyone to the Art Pharmacy Community Conversation focused on strengthening Franklin in our Art Pharmacy programs. My name is Corey Shea. I'm the Director of Arts and Culture and the Creative Economy for the town of Franklin. It is truly wonderful to see so many community members, artists, and creative minds gathered here to explore the intersection of arts, wellness, and community impact. The Art Pharmacy Initiative is all about harnessing the power of art to heal, connect, and strengthen our communities. Today, we'll be diving into meaningful discussions on how creative expression can support mental health, social connection, and well-being for all. We're honored to have with us inspiring lineup, here they are, of speakers who will share their expertise, experiences, and insights on the importance of art and healing. So what I'm gonna ask you to do now is please just make sure your cell phones are silent, and then we're going to have the questions at the end of this conversation, because that's exactly what this is. This is a conversation of all of us to learn together. So don't hesitate, there's no stupid question, all right? And on the back of the handouts, which our lovely volunteers have shared, there's a space for Q&A, so if you need to write it down, I'm someone that needs to write it down. There's space to do that. All right, so let me introduce our speakers. We have Michael J. Bobbitt here, the Executive Director of the Massachusetts Cultural Council, the state agency dedicated to supporting arts, culture, and the creative economy in Massachusetts. A leader in the arts sector, Bobbitt brings extensive experience as a playwright, director, and arts advocate. Before joining Mass Cultural Council, he served as the artistic director of the New Rep Theater in Watertown and spent over a decade as the artistic director of Adventure Theater MTC in Maryland. Passionate about equity, access, and the transformative power of the arts, Bobbitt worked to expand cultural investments across the state, championing the role of creativity in the community development and economic growth. Also, fun side note, a huge factor as to why I'm standing here right now is because Michael advocated for a role such as mine in the community. So thank you, Michael. Next, we have Emily Devlin from Art Pharmacy. Emily, there we go. Emily is the head of strategic partnership and clinical innovation. Devlin is a licensed independent social worker with over 10 years of experience, blending clinical training with mental health tech expertise, building and implementing new solutions from the ground up for community wellness. Thank you, Emily. And last but not least, you may have seen her on your local cable television. It is Amy Virguletti, the Deputy Town Administrator of Franklin. Amy boasts over 20 years of experience in administrative and professional management and brings expertise in economic development, public policy, and community outreach in the public sector. Prior to coming to Franklin, Amy served as several capacities in the state and local level, including the state legislature and the Boston City Council and Town of Wellesley. As part of her role as Deputy Town Administrator, Amy has been tasked with many things, I should say. Has been tasked with business and economic development projects, including the most outstanding, lovely town new branding and marketing project and web redesign. So thank you. And also just one other major factor why Amy is here is because she is responsible for leading a more enhanced coordination of social services in town related to mental health, opioid and substance use education, prevention and response, food security, homelessness, and housing. Later on in our discussion, Amy will give more context as to how we're using the settlement funding to launch this infrastructure within Franklin. All right, but before we officially begin our discussion, I would like to thank Raylan Mercer. Yay, Raylan. The president and executive director of the Franklin Performing Arts Company. Raylan is the visionary behind the Black Box, to share a few words. So come on over, Raylan.
We're happy to welcome you today to the Black Box. As Amy said, I am artistic and executive director of the Franklin Performing Arts Company that makes its home here at the Black Box. I'm also founder and director of the Franklin School for the Performing Arts, located right across the parking lot, where we're celebrating our 40th anniversary this year in downtown Franklin. Very proud of that. Just a quick history how we got here. A number of years into operating the school, a number of us got together and decided to launch a production company, the Franklin Performing Arts Company. So in 1991, that was initiated. We had a community theater organization that welcomed professionals into our programming until we did a feasibility study and then a long search for a home of our own. And in 2014, with the help of a grant from the Mass Cultural Facilities Fund, we were able to renovate this office building into the Black Box, which now has served us now in our 11th season. And 4 years ago, because I didn't have enough to do during the pandemic, we became an equity professional theater company. So we're very proud to be the only equity company out here in Metro West. And we currently have a lovely network of New York-based actors who love to come to our area to perform, as well as a growing community of Boston area professionals, as well as meeting our goal for emerging artists. We have a relationship with Dean College that has been recently forged. And so we will have Dean students performing and getting credit with their BFA musical theater program over at the college and enhancing our performances, as well as students who share the stage with the professionals we bring in. We're certainly anxious to find out more about Art Pharmacy, and we're happy to welcome the Mass Cultural Council and to hear about this great program. Thanks very much and welcome.
Excellent. Now, without further ado, let's welcome Michael Bobbitt.
Hey everyone, how are you? Good. It's great to be in Franklin. I can't tell you how much I love Franklin. It's nice to be back in this space. But all the arts and culture that you have here, the Cultural District, and special shout out to my friends at Dean College who gave me an honorary doctorate last year. So I am really fondly in love. Also, I am just, I'm so impressed by the leadership of the town administrators in creating a Corey Shea position that we want cemented into law for the next thousands of years, as you can say, right? And for the idea of using the settlement money to fund Art Pharmacy. It's incredible leadership, and I'm hoping you will join me on a virtual tour around the country so we can share this information with other municipalities, because it's a great way to show leadership. So congratulations to you all for all that you're doing. Thank you so much. So if you don't know, am I blocking that? That's your head.
Sorry, it's my big head. I'll get closer to you. Is that helpful?
Yeah. That should have said Franklin, I'm sorry, not Boston University.
All right, no judgment.
Next slide, please. If you don't know Mass Cultural Council, we are an independent state agency here to support the creative and cultural sector. First of all, thank you all for paying your taxes, because that is how we are funded. Feel free to reach out to your legislators. We know one of them is an amazing entertainer and supports arts and culture, but let them know, do whatever Michael Bobbitt asks you to do. That's the best way to approach them. We have a lot of work that we're doing, but you can see up here our main funding areas in the work that we do. Next slide. So just to tell you a little bit more about this and to level set a little bit, the most renowned health sector maybe in the world is right here in our state. And 40% of the budget, the whole budget, goes to support healthcare. And only in 80% of that, 40% is used to support sick care. What happens if we shift some of those resources to preventative care? So that's the whole impetus of why we created this program. And I have to give a big shout out to Eric Holmgren back here in the back row, and our colleague Kate Swaybeck, who also created this program and piloted it and worked out all the kinks and helped me to build this relationship with Art Pharmacy. So we're grateful to Eric for his leadership in this. Next slide. Here's some other information to level set. If you are suffering from loneliness, you have adverse effects on your health. So 50% increased risk in dementia, 31% increased risk for stroke, 29% increased risk for heart attack, and half of us suffer from loneliness. Half of us suffer from loneliness. It's more detrimental to your health than smoking 15 cigarettes a day. Loneliness. Our Surgeon General, our former Surgeon General, named loneliness as a major epidemic for us. So we have to do something about this, right? And who better to solve loneliness's problem than the creative sector? Next slide. So social prescribing is a concept that sort of came out of the 70s, whereby healthcare providers were using other interventions to deal with mental health and physical health issues. It really was cemented and studied and practiced in Canada and the UK, and then 5 years ago, Eric and a team went over to, 5 or 6 years ago, Eric and a team went over to the UK and talked to Canadians about how they were doing it, and we decided to adopt it and pilot it here. In the beginning, we had about 31 healthcare providers or so, and 12 or 13 arts organizations participate in this. We piloted this work for a few years. Eric likes to tell the story that we were going to do a briefing at the State House in early March of 2020, but they were called away to go to another briefing about this thing called COVID-19. But the healthcare sector and the art sector persevered. They still wanted to do this. So we launched this program, and we built it and got a lot of data. And then in 2023, we decided we needed some help, that this needed to be mainstream, that every single resident of Massachusetts deserved to be prescribed arts for their physical and mental health challenges. So we did a national search. We had a consultant who looked all around and came upon our friends Art Pharmacy. Next slide. And so we started partnering with them a couple of years ago, and we spent some time building the foundation for it. And I think it launched nationally in July. We are the first state in the whole nation to have a statewide social prescribing solution. Give yourselves a hand for that. I am spending about at least 3 or 4 hours a month in Zoom calls with my friends at Art Pharmacy, or traveling around the country to brag on the work that they're doing, and other states are starting to pick it up. And so the hope is that this will just be part of your natural experience of going to see a doctor. In maybe 3 to 4 years, when you go to your doctor, they're going to say, hey, how's your eating habit? How are your sleeping habits? How's your stress level? How is your exercise? How is your arts engagement, right? That is the goal. That is the goal. Next. Some new information coming out of some research done in Canada. For every $1 invested in social prescribing, we save healthcare $4.43. What? Go back to that 40% of the state budget is spent on healthcare, and 80% of that is on sick care. Here's the answer. Put more money into preventative care, save healthcare, make people feel better. Some other data, 296 million savings in annual costs for reduced hospital admission and emergency visits, 114 million in annual cost savings from reduced primary care visits, 60 million annual increase in employment income for youth and depressive symptoms, almost 17,000 fewer cases of coronary artery disease, and 2,000 fewer cases of avoidable deaths. The arts are a solution for loneliness in healthcare. It's time we get paid for it, for the work we've been doing for millennia. All right, cool. Next slide. Yes, so I don't know if you want time for questions or we'll move on to, okay, great. So the rock star of the day, Emily, will tell you how this amazing program works because we need your help. The main thing the art sector can do is to get into rooms with healthcare. This is a healthcare solution. We want to get paid for the work that we do. It's important that you all spend time in healthcare rooms selling this idea. Okay, thank you all.
Thank you, Michael.
It's been I was about to say, that was a lot of hype. I also have not used a microphone in a bit, so I spend a lot of time on Zoom with Michael, not as much on the in-person side. So it is great to meet all of you. Thank you so much for coming out. Huge thank you to Mass Cultural Council as well as Town of Franklin. We're really, really excited about this launch. It is the first town to really be utilizing the opioid settlement funds to really expand access to arts and culture. And so I want to give you a very brief kind of overview of, I mean, Michael did a great job, but the impact of the arts and health side as well as social prescription. Talk a little bit about what we do at Art Pharmacy. It's a really amazing program, and we're really excited to be sharing it with Franklin residents. And then kind of next steps as to what to do before I hand it off to Amy. So I will ask you to go to the next slide if you're okay with that. So a little bit about us. So we are actually a Georgia-based organization. I am here in Boston. I have lived here for a very long time. But we are really excited to be partnering with the Mass Cultural Council as one of our first states that we're launching in. So we're based in Georgia. We utilize social prescribing services across a few different states. We just launched in New York yesterday, actually, Massachusetts, Connecticut, California, and Georgia. So we're really excited to be expanding and sharing more about how to utilize arts and culture. And you can go to the next slide. It gives us some context. So like Corey mentioned, I am a social worker by training. I can very much am focused on finding innovative ways to think about arts and health. And so when we think about traditional treatment, I know it's a little bit tricky to see. We kind of think about it like a stool, right? So the biopsychosocial approach is what we utilize typically as healthcare providers. We think a lot about the physical side, right? So we think about physical care, how we support on the bio side of that stool. We think a lot about the psychological side, right? We're, especially in the last couple years, I think I've seen some amazing trends in terms of how we're supporting mental health and wellness through typical, individual therapy, group therapy, things that come to mind. But something that we are really missing is that third leg of the stool, which is the social side. And we're seeing that be a huge piece of why people are having increased anxiety, increased loneliness, increased depression. And how to solve that third leg of the stool is tricky, right? How do we get people out into their community? How do we get people feeling excited about joining something, feeling a part and inclusion? And so really our goal, and you can go to the next slide, Corey, is integrating and finding community and impacting loneliness through arts and health. And so, as Michael said, he did an amazing intro. I mean, artists have been healers since the beginning of time, right? They are an amazing resource within the community. And there's a ton of literature out there around the impact that arts can have on health, on well-being, on mental health. And so really our goal at Art Pharmacy is integrating that social prescribing approach that Michael talked about, which is really around integrating and finding other solutions outside of traditional healthcare. And integrating that with arts and health so that we're able to really be able to provide social prescriptions for arts and health within communities to support well-being. And so we do this a couple different ways, and I'm gonna spend a little bit of time on this slide because it's important. I know it's a little bit tricky to see. No, it's okay. I mean, it's small, it's good. So everybody will just have to pay attention to me as I'm talking instead of looking at the visual, it's good. So really at Art Pharmacy, we do a couple different things. So we serve people across the lifespan. I would say we have two really target groups that we've seen a lot of traction with. We've seen youth and young adults, so typically like 13 to 26-year-olds, and then we see a large percentage of folks coming to us as older adults, struggling with the aging process, chronic illness, and so we serve folks throughout that lifespan. And we do this a couple different ways. Really, what we see is a referral coming in, and so I'll give an example of like a community organization, because this is who we're going to be working with on the Franklin side. A community organization refers a member to us. And so we call them members because they are part of this community with us as well. They refer a member, and they can be based on a variety of things. For Franklin, these are going to be folks that are either in recovery for opioid use disorder or as a prevention tool. And so that referring provider can be anybody in the community. They're referring that member to us. It's an easy digital form, takes 3 minutes, and we receive that form, and we have our care navigators reach out and really support the individual to utilize the services. Our care navigators are similar to like a community health worker. They come with a variety of experience, both on the arts and health side as well as the mental health side. And they are meeting with the individual. They are better understanding their needs. So they are understanding, hey, why are you coming to us? What do you need in terms of your health goals? What are you interested in for arts and culture? Are you interested in pottery classes? Are you interested in the theater? Are you interested in a dance class? And then what we utilize is a tool on our end that helps us to match members with community organizations and events within their community, and we give them an opportunity to connect. And so our care navigators are sending about 3 to 4, on average, events per month for members to choose from. They get to select, right? They have agency and choice as to what is interesting to them. If they say, I don't think any of these are interesting to me this month, we send a new list. But the great opportunity there is that we're providing agency and choice connections within the community and a way for that care navigator to help individuals. We also offer companion tickets for everybody. If we're going to be supporting individuals with combating loneliness in the community, right, we want to make sure that they're able to bring folks. So we see individuals bring their friends, their family members, caregivers, children, really great opportunity to connect there. And so once the individual participates, we follow up with them. So we learn, hey, how'd the event go? Were you interested? Was this something, that felt really good? We're also taking clinical assessments. This is a huge piece of our kind of puzzle, is making sure that individuals are doing better, that we're tracking their well-being. And we do this over and over. So essentially, typically a prescription's for a year, 12 doses is what we call it. So 12 events over the year, and a really, really great opportunity for individuals to connect. You can go to the next slide. I think that was everything on there. I'm sure I missed something, but.
You did great.
Yeah, so, so really our opportunity here is we are focused on creating a whole solution here, right? Like Michael said, thinking about how we think about arts and health and how we connect with providers is really, really important to us. I think as a clinician myself, for many years, I was in the Boston Public Schools as a social worker. The amount of times that I just heard kids, families, individuals say to me, this is great, therapy's great, it's really, really helping him, but like he has a lot of energy, or she's feeling really lonely and feeling all types of symptoms, and being able to find something in the community, make that easier for them to connect, is such a big piece. And so we really integrate both the amazing cultural organizations that I know there's a ton of you here today, along with our prescribing partners, our referrers, to really make sure that that link is available, that we're able to make that strong connection for folks. Yeah, go ahead. And so for the arts organizations that are here, I think I really like to highlight a few that we already have down at the bottom there, that we already have with Franklin. I think I'm also really, really excited to call out just how we think about arts and culture and who can be involved. So we think about kind of the 4 different pieces of this. We think about the disciplines themselves. So we think about things like visual art, music, dance, theater. We have a ton of partnerships with museums across the Commonwealth. We think about the delivery method. So we have in-person engagements, but we also have a lot of virtual for folks that aren't ready to leave the house yet, who are dealing with chronic illness, who need support. So we have different delivery methods there. We like to really think about the types of experiences that individuals like to have. So there's different kinds of participation modes, as you know, as artists, but thinking through specifically for individuals on the mental health side, what makes the most sense for them? Is it a participatory experience where they are working through a workshop, or they're doing a arts and craft-based activity, they're in a community conversation like we are today? Or is it more of a receptive experience, right? Are they sitting in a theater? Are they, going on a walking tour? Are they, visiting a museum? We really make sure that's part of kind of our work that we're doing on the Care Navigator side to support those individuals, to make sure they feel excited and engaged to go into the community. And so I've talked a lot about this, I don't need to belabor it, but I think my biggest piece, especially as a social worker, is thinking through ways that we think about mental health care differently. I know it's really hard when somebody comes into my office as a therapist, right? You have to be very vulnerable, and healthcare doesn't always bring a ton of joy. And so I think a lot about Art Pharmacy that's exciting is that we're giving a lot of agency and choice to individuals who may not have historic choice, especially around medical care. And so we have a really great opportunity for them to figure out what works for them, where they want to go. It's stigma-free, which is a huge piece. A lot of folks, especially, the conversation has definitely changed around behavioral health over the past couple years, but it's not the end, right? There's still a lot of stigma, especially for a lot of communities around mental health. And so how do we support that? How do we continue to offer stigma-free solutions? This is one of them, which is great. And then I think the only other piece to call out on this slide would be really accessibility. We really, really like to make sure that whenever we're meeting a member, that we're meeting them where they are. We work with a lot of folks with significant physical disabilities or developmental disabilities, and really wanting to think through how to support them to get to an engagement. We can make anything happen, truly, and I always tell our team, and so thinking through how to make accessible care and for it to be engaging and accessible is really, really important to us as well. And so just a few numbers up here, and I'm gonna do this even though I just like to make sure I'm being accurate. I think our biggest piece is we're really excited about our outcomes so far. We've worked with a couple hundred members so far, which is incredible. My biggest one is that 86% of improvement, clinical improvement that we're seeing. Like I mentioned, we're measuring clinical improvement, across the program. And so we're seeing a huge increase in kind of general well-being for individuals, which is amazing. And we see really, really high engagement. I think that really speaks to truly making this agency and choice for individuals. It's something that people want to do, they're feeling joyful and care, which is amazing. And we're seeing a really, really, high satisfaction as well, which is great. And so I'm not gonna belabor either of these points. I think, like I mentioned, there's two kind of subsections that we focus on. I would say youth and young adults are a huge piece of that. And we really cater our solution to support, different populations of individuals. The youth who come to us obviously need something different than the older adults, right? We know how to interact with those individuals, and we also make sure that the solution's tailored to them. And so for youth, we're really focused on, off-screen interactions, things within the community that feel really empowering, giving that agency and choice, finding safe spaces in the community that are sustainable, which is a really important piece. And focusing on digital communication. We know that we're utilizing email and text to reach youth, and that's something that they're going to engage with, versus with our older adults, we're hopping on the phone, we're talking more frequently via typical communication, snail mail, in order to make sure that we're able to reach them. And on the older adult side, you can go to the next slide. On the older adult side, we're really, really focusing on making sure that we're finding joy in healthcare. I think that's been one of the biggest things that we've heard from individuals. And really finding family relationships that are something that is important, right? Typically, and I don't know who's been a caregiver for an older adult or a family member who needs support, but typically that turns into a lot of caregiving, a lot of medical care. And so this is a really great opportunity with companion passes and engaging in the arts for individuals to really be able to find joy together, find something joyful, find a shared experience, which is incredible. And really, leaning into exploration for the older adult population, which is great. And so, quickly, and then I'm sure there's gonna be a bunch of questions. So I think our biggest piece with Franklin, like I mentioned, this is the first town that's really utilizing the opioid settlement funds to, expand, which is amazing. And so we are really, really excited to be offering this to folks who are either in recovery or as a prevention tool for folks who are needing some additional support of any age. So it's a really, really great opportunity for us to be working together. And so if you go to the next page, so there's a great group of people here, I think, from both of our kind of sides of our organization. So we have our arts and culture partner side, which is really our network of partners. We're really working with individuals who do arts and culture and the amazing things in the community to connect members to. And so if you are an arts and culture partner, we would love to hear from you. You can join the network, which is an amazing opportunity for us to be able to send members your way. And this is a variety of organizations, right? And if you have a question of whether or not yours fits, my guess is that it does. Happy to answer it. And then there's this referring partner side. And so our referring partners are the amazing folks who are identifying individuals in the community who this could be a help for. And typically what we do is a really, really quick, 15, 20-minute Zoom training with me, walking through how to complete a referral form and who would be a good fit, but can play a really, really key role, especially for individuals who are working with folks in the community who know that this is something that they may need, or maybe an additional tool in the tool belt, which I think is an incredible opportunity. So I know there were some flyers in the front. They have a fancy QR code on them. You can also email me if you don't have a QR code ability to do that. But I'm happy to kind of support all of you and really, really excited to make connections within the community. And we just appreciate everybody being here and sharing more. So I'm sure I will have plenty of questions, but appreciate you taking the time. So thank you.
Excellent, thank you. So now we'll have Amy come up to give a little context of how the settlement funding is supporting the infrastructure here, and then we'll open it up for a little Q&A. All right, Amy?
Thank you so much, Corey. I also want to thank you so much for putting this all together, and I really appreciate it. And thank you, Michael and Emily, for giving such great presentations on what Art Pharmacy and the Mass Cultural Council are doing to support us. So I just wanted to kind of talk a little bit about how we were able to do this here in Franklin. Several years ago, many of you might know, Massachusetts participated in a nationwide financial settlements with several companies as part of the legal efforts to demand abatement from the harms caused from the opioid epidemic. Franklin opted into these settlements with the Commonwealth, which combined will bring over $900 million into Massachusetts for substance use prevention, harm reduction, treatment, and recovery support, which is amazing. Of this funding, $1.7 million will be allotted for Franklin, and that money will be distributed in allotments from the calendar years 2022 to 2038. So we'll be receiving this funding from the settlements for several years. Of the payments we've received thus far, the Franklin Town Council, and I just want to acknowledge Melanie Hamlin and Ted Cormier-Ledger of our town council that are here today. They helped in providing Art Pharmacy with the $56,000 to help address substance use disorder, mainly in this case for prevention and recovery support in our community. I was really inspired to see Michael Bobbitt speak last year. He talked similar to what he did today about the benefits of arts and culture for those suffering from mental health and loneliness. Knowing the robust arts and culture scene here in Franklin, I thought not only should our cultural partners be involved in the state program, we should pilot programs specific to Franklin using our opioid settlement funds. And thankfully, we were able to do that just a few weeks ago with the council. Having personal experience with individuals close to me trying to live a life of sobriety, I realize how hard it is. It's really hard work to do that and kind of understand how you're going to live, a sober life. I've seen people struggling and learning how to live a full life while also trying to be sober. And when I heard Michael talk, I felt this model could fill a missing piece on the pathway to sobriety. Or, like I said, as a preventative measure for those that are trying to stay away from substance use. As I mentioned, this funding will allow Art Pharmacy to send members to arts and cultural engagements in Franklin, and it will be paid for through the town's opioid settlement funds. When prescribers send members to programs, it's free to them. The organizations receive new patrons. Members benefit from the work these programs do, and opioid settlements funds pay full price for admissions to local arts and cultural programs, such as the Dean College dance and theater performances, the Black Box theater performances, Town of Franklin recreational programs, Franklin lifelong learning programs, and so on. I look at it as a win-win for everyone, and I encourage all of you to get involved either as a referring partner or as an art partner. I think it will be a great opportunity for Franklin to be involved, and I encourage you all to ask questions, and we're here to answer them. Thank you so much.
Now, do you all feel so inspired? I hope so. That was the end goal here. All right, now we're going to take the next few minutes. If we could brighten the lights up a little bit. I know I love the romantic lighting, but just during the Q&A so you can see each other a little bit would be fantastic. Thank you. And I will just say for the Q&A, we'll just have you stand up, and we'll do a little point, and we'll go from there. Who wants to be the first one? Or how about I call on you? Is that a little scary? Steve Sherlock, what do you got?
I will be bashful. Steve Sherlock, the Volunteers Community Information Director for Franklin Matters, Franklin Public Radio. I buy the story, I get it. The funding to start, approximately how long does that last in terms of kind of care treatments? Is there a way to quantify that? Because I'm thinking that clearly we can use it, and we've got more funding coming, but how long does this piece get us? And then, assuming we decide we want it, this proves, how long is that going to keep going? So something in that area, maybe?
So my understanding is that the funding for this can come from numerous sources.
True.
So we already have examples of statewide insurance companies funding this. We have managed care providers using Medicare and Medicaid money, philanthropy. So that the funding can come from any different source. So part of what you all have to do is continue to raise money or talk to healthcare about making sure it's part of their plan. So it just depends on how much pressure we put on them to release some funds to support this. As far as the opioid settlement money, I don't know if that's an annual thing or not.
So the opioid settlement money, we did a 2-year contract with our pharmacy for the $56,000. And it's kind of a pilot. So we're gonna see how it goes, how many people are interested, and then we'll, I'm sure we'll revisit it at that point in time, or, after a year, and kind of see how things are going. But really, our contract that we put forth with our pharmacy was for the 2-year contract for the 50-something.
Also, in case it wasn't clear, the arts organizations that are in network get reimbursed for the tickets they provide.
Yeah.
So I'm hoping to get a prescription to the Beyonce concert. It's expensive. It's so expensive. Is she broke or something? Because she came out with her fragrance the next week, and I'm like, I can't spend all my money, Beyonce.
She'll do that.
I also will say to that point, not on the Beyonce point, although we get that question quite a bit. I think truly the biggest piece of this, because it's new, right? Because we're talking about a alternative type of medicine. A lot of the work we're doing on the art pharmacy side is around advocacy, around formal partnerships to expand this to more folks. This is an amazing opportunity, obviously on the Franklin side, but we are kind of continuing to make sure this is wide stream enough that, to Michael's point, 4 or 5 years from now, you're able to walk into a doctor's office and it's available to everybody, right? So that's the goal. Big dream for sure, but making progress. So.
Steve, do you have a follow-up?
Yeah. Since I'm on the roll, so to speak. Clearly, we've got the arts organizations here, and we've kind of got the funding model. I assume amongst the next steps, we're going to have to start talking to the healthcare providers as well.
There are some in the crowd. They are here.
That is the goal, for sure. And it's those referring providers, right? So it can be anybody in the community. It can be medical professionals, therapists, social workers, community members. We've talked about fire and police department, schools. Like, that is an amazing opportunity for anybody. I know the prescribing often sounds like, a psychiatrist or a doctor. We're opening that up to everybody, right? So that's an amazing opportunity.
We have our health department here. We have our co-response team with the police who are interacting with individuals on a daily basis in our community. We have our library, our senior center. They might be able to identify people. Our schools are here as well, which will be a huge piece to this. We'll be able to identify individuals that may benefit from this. And then they'll just, they would just have to do the 15, 20-minute training on how to fill out the referral form, and then they would go to our pharmacy. And then our pharmacy works with that individual to say, this might be a good fit for you, or, what are you interested in?
Ted, what do you got?
First of all, thank you for being here. Thank you all for being here. This is fantastic. I wonder if there's a way, as a father of a child with autism, with an extensive IEP that has not only academic but behavioral, social, and emotional goals. We have a huge in-home team that works with us. I wonder if there's a way for the school department and you guys to partner looking at families that already have IEPs like mine, rather than us having to reach out, because sometimes that can be overwhelming. We're already juggling a ton, right? But if like through the IEP meetings, if somebody said to me, you know, the lead provider said, hey, Mr. Cormier-Ledger, we have this partnership with our pharmacy that can help your son, because the preventative piece that you talked about is huge. Because children with autism are already identified as high risk for substance abuse as teens and adults. Because they struggle with that ability to make the right decisions, they struggle with peer pressure, they struggle with something right in front of them, that impulse control, right? So we deal with that as a family every day, but knowing that, well, maybe there's a couple of programs, not just tickets or theater, but maybe there's something a little more long-term. Just a thought to, you could connect those dots.
That's a great suggestion. What do you guys think over there, school? No pressure, but what do you think?
It's another tool in the toolbox when they're trying to look at this stuff. I think Ted's point is around a proactive approach to it versus the reactive.
Great. Amy, did you want to say something?
First of all, thank you for telling me about this. I'm Amy Belos. I am Creative Corner Art Studio downtown. I've known Teddy for a while, and actually, I've been doing this for 2 years. 2 years ago, I came to Teddy and I said, there's, you know, the Surgeon General said there's a major crunch with coming off of COVID, anxiety, depression, and I said, I have this vision. So he knows I can't write with a lick. We got in front of the state senate, and I, you know, made a pitch that I want to do these open studios, allowing for kids to come. So we're doing it right now, and I have kids from Brookline with autism, kids that are high risk that come in, and the parents find out from my network of social workers, whether it's Needham, Wellesley, Franklin, you know, that we're doing it right now, but I'm doing it on volunteers and friends coming in and, you know, trying to make this. And I have families that come up to me that said, you know, we wish we would have known our kids on an IEP, or we wish we would have known, like we found out through mutual friends. And she knows, I'm running to my end of, I can't pull any more friends volunteering. I have social work. We incorporate Eastern Med, where we do Reiki art. We do a bunch of other things. So this is good, and I'll be giving you my card because we're at a point now where we're growing. There's such a demand.
Amazing.
But I think to Ted's point, it would be good because parents are saying if you could collaborate something with the schools, because my social, you know, medical peeps they're telling their clients, hey, go to an open studio downtown. And that's the other thing, like, I'm already doing this. I've been doing this for 2 years, but it's at a point now where, you know, we need funding.
Yeah.
And there's a great group that I know from your world that take my calls because, like I said, I'm not, you know, I've gone for grants, I've gotten things, but I'm not a writer. So I'd like to see more funding and find out how we get our hands on that, because my volunteers are starting to say, whether it's the social worker that comes in or the artist that does something.
There's that creative economy.
I would encourage you to use ChatGPT for your writing. That's amazing. I use it all the time. Don't tell anyone, but half my keynotes are written by Chat. But the other thing, and so what I want us to pivot our brain to is to not think about funding, but think about financing. Because the goal of this, in my mind, is for this intervention to be financed with the stability that medical intervention is financed with, right?
Absolutely.
So if we can think not so much about philanthropy filling in the blanks, but all the resources we have, including healthcare, which makes a lot of money, to finance this work.
Like, I'm turning kids away right now. I had one of my social workers send me 3 kids. I'm like, I don't have enough people. I'm like, I'm a single mom. I can be there so much. But, you know, like, I only can take 10 kids or 10 adult. We do adults too. Like, you know, but I'm like,
Let's figure out how to,
it's okay. I just put it.
well, if you're turning kids away, let's figure out how to get them to another arts organization. We don't want to turn them away. By the way, we're coming out with data soon, and we'll be sharing it across the state, but we did an inventory of all the assets we have in Massachusetts. There are 15,063 arts organizations in Massachusetts.
Round of applause for us. That's amazing.
So, lots of places we can send them if you can't take them.
Meg.
So Meg Egan from Museum of Franklin. So data was exactly where I was going with my question. So it was great to see the data from Canada and the outcomes data that you have so far. How is our pharmacy collecting outcomes data? Are there any ongoing studies to look at outcomes, and how as a community can we help support that?
Amazing question. Very much appreciate it. Very data driven, which is great. So we collect a couple different pieces of data. So at intake, so once you refer a member to us, we have them complete a set of clinical assessments. We really focus on general well-being. So we use the WHO-5. We'll get technical for 2 seconds. We focus on anxiety and depression. So the PHQ-ADS, it's a composite assessment. And then we use the UCLA 3 loneliness scale. So we are ranking individuals across those and then tracking after each event, kind of decreases or increases in those scores, and really focused on tracking that over time throughout their prescription. That's correct. So really our goal and what we typically see, and you saw it there, we see a ton of clinical improvement month over month. I would say we see a big first jump after that first event, as expected. A lot of excitement, a lot of pride for being able to go, a lot of hope and optimism. And then really after that 4th or 5th dose, we start to see that additional jump, which is amazing. And so we reflect all that back to, this will be going to Amy and going to the state in terms of what we're seeing in terms of changes, which will be really, really impactful. And really awesome ability for us also when we are receiving scores, if there is any changes that are concerning, right? So somebody reaching out to us showing a low drop in scores or needing additional support, we have connections to, be able to provide them with additional support and provide that information actually back to the referring partner so that they're able to check in, live time, right? We can only do so much to a point, but really making sure that that closed loop system is there to be able to support individuals as well. So excited to see data coming out of that, and we're excited to share back as well. Yeah.
I'm sorry, I can't see your name tag, but hello. Hi, Sue.
Retired special ed administrator, currently senior citizen. But when I was working, I worked with a lot of the kids in district who are from the district who are out of district for mental health reasons. And I wondered about the impact of this for kids with school refusal. The kids, the high anxiety kids, some of those Asperger kids who have real social skills challenges, because this could be such a tool for us in the school district as far as almost like a intermediary step before kids fall apart. And then I wondered, are you the contact? Who has to make the referral? Does it have to be a licensed social worker? Can it be a teacher? Can it be?
Emily, you want to answer that?
Yeah, so I'll answer that one first so I don't forget it, and then I'll answer your second one, your first question. So referring partners can be anybody. It can be a teacher, it can be anybody in the community. So it does not have to be a social worker. So teachers, special educators, anybody from the school side. So in terms of your first question, any data, and we have some partnerships with youth, younger youth. I would say the majority of our partnerships are that 16 to 23-year-old range, and a lot of working with university students as well. And what we're seeing in terms of data around school refusal or not coming to school and that anxiety with coming, we're seeing a lot in terms of folks being able to feel empowered to be able to do that. A lot on the university side as well. We work with a lot of college freshmen, so you can imagine coming onto campus for the first time, feeling a lot of anxiety, not attending classes, not doing well academically because of some anxiety. And so we see, a decent decrease in terms of their anxiety, but also just anecdotally, right? And qualitatively, hearing a lot of stories about being able to find friendships in the community, finding that community. So absolutely, would love to continue to chat with you on any way to do that. And I think to Michael's point, some financial ways to do that. Yeah, and financial ways to do that, right?
Do you remember in the 80s when we discovered that physical fitness was good for your health? Yeah. We were like, oh, we never thought of that. And then programs like Silver Sneakers came out, right? I mean, but that is the goal of this. The science has been there for 20, 30 years now, but finally we're starting to put the science, the arts, and the financing together to say that this is a good investment to save people's lives, to save money. And so the big thing to scale this is going to be about us pontificating and proselytizing and promoting this in every room that we can get in. And then we're going to get to the place where it's just going to be part of the norm. Yeah.
Shannon?
Do you partner with any music or art therapists?
Great question. We do on occasion. I think our biggest goal is that it's not, our community organizations are more general, more broad, so more on the community organization side in terms of classes or opportunities there. So we don't provide therapy, if that makes sense, or connect with therapists. But we do have a lot of folks who are music art therapists who also have workshops or private lessons or opportunities in that space, or private artists. We absolutely partner with those individuals. So if that is you, I love that. I'm excited to hear more. Absolutely, amazing, yeah.
And then I saw Heather over there.
Yeah, hi, I'm Heather Carroll. I'm on the Franklin Cultural Council, but I'm also a social worker. And I work with older adults, but not here in Cambridge. But when I think about serving older adults, especially with complex chronic illness, there's so many barriers for them to go somewhere.
Absolutely.
And when you're talking about virtual, there's a lot of barriers with older adults.
Absolutely.
We have several assisted living, memory care, in Franklin. So how do you address some of those barriers like transportation or technology for older adults?
Absolutely. Great question. I'm so happy you brought it up. And I think our biggest goal, like I said, is getting folks to where they want to be in the safest, most accessible way, right? And so when we are meeting with individuals, especially older adults, we are talking usually on the phone. So a lot, like I said, on our youth side and our younger adults, we are working more digital. But with our older adults, we're talking to folks on the phone. We are learning, do you have any physical needs or awareness that we have or that you need? Do you have any concerns around cognitive ability where you are needing to get out into the community that we need to know about? And we really are working with those community organizations. So I am on the side of the referring partners as a social worker, but I have a partner within our organization who works very closely with Michael and Eric, who is really building that network with those community partners. And when we have a new partner come into the network, they are giving us all of their information around accessibility, their ability to cater in terms of supporting various needs and accessibility needs. So we are really making sure that that match fits and that it's something before we recommend it to a member, that it's a right fit beforehand, right? We're not getting hopes up. We're really, really making sure that it's a good fit on the partner side. And then we're really working with individuals, I would say, days leading up to the event to make sure that they're in a good spot. How are you getting there? How are we arranging transportation? How are we supporting you to do that? We have older adults who ask us, what am I wearing? Is it going to be cold in the museum, right? These are all valid questions that our care navigators are working with those individuals day in and day out to make sure that they feel successful, which is an amazing part of our jobs, I think, is getting to know those individuals, but making sure that we're treating everybody as an individual and meeting their needs where they're at.
And the transportation is paid for, right?
Yeah. Yeah.
Best solution ever,
Paid transportation, could it get any better?
Some of the memory care units that we have here, and like really hard for that to get out of there.
Yes. Yeah. So that is a great question. We've had that question quite a bit on are folks going to the actual events themselves. Some of those artists that offer private lessons, we have had arrangements where we're able to have folks go to the location where the individual's at. And we've absolutely worked that out kind of on a, like an individual by individual basis. But it's a really, really great opportunity there, which is amazing. So, yeah.
And then Christine.
Thank you. I'm a member of the Art Association in Franklin. I would like to know, maybe you've seen this already happen, or what do you envision as the way this works? What does that look like? If we have individual artists who are capable fine artists, but we offer Franklin meeting every month, and we see demonstrations. We have, full live, sometimes hands-on demonstration. So is that what you are conceiving, or do you see where we are as an association at Whole Week is that we can get a place, an actual, building with rooms to produce art, and then I can see it happening to more people.
I'm doing that now, and I'm actually going to be opening an art gallery. I've been doing this for 20 years. I mean, what I did in Needham, I want to do here. And I don't know if you're aware, if you probably are, But the MFA, like they offer programs for seniors and kids where they will help find busing. My Needham location, we would take 20 kids on Wednesday nights. They'd go for free. We'd bring our own lunch. We'd get picked up. Like they do that too. Like if a group of seniors want to go, because like, I don't know about you guys, but if I ask a teenager what the MFA is and they look at me like I have two heads, and I'm like, how can you not know what this is? So that's another resource that I know in the past, they will, like seniors or kids, they do a program. You get to go for free, and there's a system, but I don't know who.
Could I actually jump into this? Because the Franklin Art Association is a signed partner. Yeah, so you're already in the cluster, which is amazing. And I would imagine that joining the membership is really the benefit because you have that cohort of artists and the programs you do offer. It feels like that is another bonus to be able to go to those demonstrations and exhibit in the community member exhibitions that you're coordinating together. So I think the association as a whole is the benefit.
And my understanding is that we're not asking you to do anything different. You do your programming, you upload that information into Art Pharmacy's system, and the Care Navigator will match the member with the existing programs that happen.
Yeah.
So if you're having demonstrations regularly, that will go into the system, and then when they go in to find out what the patient wants to do.
Yeah, it'll just pop up. So anything that you are doing, you let us know. You don't even have to do anything on our side. We put everything in for you. But yeah, it's that matching ability. So it can be really anything. I'm sure you guys are doing some amazing work across the board. So yeah.
Thank you.
Yeah.
Meg.
Going back to the public transportation question, at the time are we able to pull Indactra into a program to support this?
I think when we kind of map this out, we can let them know what the options are for transportation in town, and then if they need to fill it in another way, we'll have to come up with a solution for that. But certainly get them knowledge.
Yeah.
It could be Uber too.
Amy?
Hi, I'm Dee Adams. I'm a local artist, community builder, and I'm also a registered partner since last fall. But I'm running into the issue of, right now I'm working with an art center, and they're a little bit unsure about how to proceed. I've gone back and forth with getting questions answered, and they're just a little nervous on, they want to do it, and they're very excited to do it, and they just don't know how to jump in. I actually provide paint sessions during several times a month. I'll go to different locations, and what I do every year is apply for a grant so that I could provide these paint sessions for senior centers around Massachusetts. And the reason for that is because there's not really a big budget for the senior centers. Worked in healthcare for over 20 years, and I really focused on healing through arts and just building social interactions that are healthy, particularly for people in older groups, but I work with every age group. Sure. And so the question is, how do I, or what can I tell them about being able to provide sessions at the Arts Center that would allow them to then kind of open that up to a different community member that would just be attending?
Yeah, absolutely. I mean, to the arts partner, there's no real difference, right? I mean, we are, as the Care Navigators, they are purchasing the tickets. If it's an online system, we're communicating with individuals via email. We are arranging all of that for the member. But the individual shows up as anybody else in the community, right, to the class. We're not identifying individuals as, coming through our pharmacy. They're not being identified, especially when we're thinking about substance abuse, any concerns around that. Like, they're showing up as a normal member in the community, and they're here to engage, right? And so for the, arts and cultural organizations, they don't really have to do anything outside of our, quick webinar with my counterpart, Adrian. But, it's a really great opportunity. I think the biggest piece is just making sure that they feel comfortable, and any questions that they have, we can answer them. But
It might be good if they have fears to connect them with someone already in network.
Yeah,
so they can
absolutely.
help answer
We're happy to do that as well.
Great, so I can.
Yeah, and we're happy to have Adrian chat, with any individuals too. Yeah.
Question. Thank you so much for answering. Question.
Yeah, what's up?
Have we in Franklin identified locations where we can provide these services already?
Well, that is what these type of meetings are all about. So we're here reaching out to the people, trying to seek out these organizations to work together collectively. So Amy and I have chatted about this is the first of many conversations, and having an ongoing cohort of community members that we can work together and sharing information with.
And I already opened to my studio, and I'm in the process working with Dean College that I do work with on something, I know it's out in the universe as I put it, but on a new location downtown. So that's what I'm doing. Like, I want to be the hub. I'm not like, there's artists already signing up to do things like that. So.
Which is
Awesome.
great.
Yeah,
And that-
I think the goal is the next 2 months, we're hoping to build out the infrastructure for this. And then I think it was May 1st.
Yep.
We're hoping to get people signed up.
And then I saw Pandora.
I just had a question. I'm trying to put the pieces together. I volunteer for an organization in the town of Franklin, and we work with families and individuals in need. So we are not artists, we're not professional caregivers, we're somewhere in between. We are volunteers. And I'm trying to figure out how do we access the system if we see a family in need, or there's a young adult, or there's an older person who would so benefit from this. It would reduce loneliness or give a chance for engagement and help. How do you jump into the
How do you
system
get it
here?
done? Yeah, so you're going to sign up as a referring partner, and you're gonna meet with me for like 15 or 20 minutes on Zoom. I'm gonna show you how to input like a referral form. It's very easy, but you are absolutely welcome to do that. Like, that is, you are a key member in the community for identifying folks, so yes, please, that'd be great.
Thank you.
Love that energy, Pandora.
Yeah.
Sarah, did you have something you wanted to share?
Hi, thank you. I'm Sarah, I'm the director of the Senior Center. And first of all, I just want to say thank you. I think we hear how often that the health system is broken, but we don't hear how often creative solutions like this are coming out in the community. So appreciative of that. I just wanted to understand the piece because I can't wait for our Zoom. We're going to be one of your new referring partners.
Can't wait.
But so what does that look like for, I know we talked a lot about the opioid settlement money and who that can be used for, but so if we have folks that don't fall into that category that we want to refer, what will that look like for that member?
Yeah, great question. So we can talk about that on an individual basis. It really depends. We have a few health plan partnerships across the Commonwealth. We have a few partnerships with like large FQHCs or large healthcare organizations. So we're gonna see how those all fit together in the pieces. Like Michael said, the goal is every single person to be covered. The reality at this moment is we're kind of figuring out who is eligible at this point. So we'll 100% go over that in our training. Excited to have that together. But yeah, I mean, that is the goal. So appreciate that.
I mean, one of the things you all can do is go home and call your health plan and say, hey, have you heard about ARTS prescriptions? I have a great company that you should be signed up with.
Mm-hmm. All right, any other questions, comments?
Yeah. I'm thinking that you're assuming I will know how to interact sensitively with whoever comes through the door. And I don't have any experience personally with people with opioid addiction problems. I have minuscule experience with spectrum disorders. So how can I kind of self-educate so that I can not mess up with somebody who's already experienced being messed with in other situations?
Amazing question. I love that. So definitely for the referring partners, that is a huge part of our training, is really how to talk about Art Pharmacy, giving you resources, giving you, really educated ways to talk about the program, and also really sensitive ways to talk about what involvement looks like that feels inclusive and engaging. So 100% join your training and hang out with me. I would love to talk more about them. That'd be great.
But also, I'm sorry, another thing of perspective is just that all of you are in this room because you are community organizers. So you may not realize that you already have the baseline of being inclusive and accessible to community members. And I think a lot of times people are just looking for that when they walk in the door. So give yourself a little credit, like you already set the stage. This is just another step in a positive direction.
Also, if I may, somebody with any of these disorders or issues with addiction, like they're not their symptoms, they're not their disorders, like they're just people. They're just people like us. I mean, we all put our own things as well. They used to feel like people. Like what a lot of these things are, they're lonely because they feel not home when they don't get out there because they're not home. What they need is that sense of around more than anything else. Just being like people. They're like, I'm fine.
Well said, Pete. And Pete also is a new prescribing partner. Pete, do you want to share how easy it was to sign up?
Oh my God, it's the easiest thing.
See?
If you guys have
Look at
any
this.
doubts at all,
Like, stop. So I love this program largely since I'm have to be a for-profit institution in order to stay open and pay the rent. And the fact that this organization pays for it, like it's not a charity sort of thing. You are being paid for your services that you're normally putting on. There's no additional cost. The only cost was, the 15 minutes of the sign up and the 45 minutes that I was on a call for it. It's the easiest thing on the planet. Just continue doing what you're doing and don't provide more folks support it. Like,
I'm gonna come to you.
I need to talk to you as well.
So that community connection.
Exactly clear that I was told what they're training. You're not expected to put on events for this.
Yeah.
Don't do more things specifically for art
Do what you
pharmacy.
normally do.
Do your normal stuff in art pharmacy will put more people in there.
Yep.
Like, it's not about, hey, any of your
It keeps it sustainable capacity. We don't need to burn ourselves out.
And I can already say, your events are already uploaded in the system.
Oh, good,
We're
perfect.
now sending some of our folks through health plan partnerships to some of your engagements for the past.
That's another thing I'm a board game store, right? Yeah. Board and card game store. Granted, a lot of it is the community building around that, but I'm a very much not traditional arts and culture sort of thing. If you're doing something that's maybe not in line with art pharmacy, you're probably in line with art pharmacy. Like, you're probably exactly the sort of things that art pharmacy needs, because it's very easy to be like, I'm a dance studio. Like, that's obvious. But if you're something just a little bit off, that's the thing that I think you guys may be lacking right now, because, healthcare problems go beyond the creative types. Like, there are weirdos, nerds, and whatnot that need it as well. So if you're anything else, please sign up.
And thank you to Corey again. I'm not like, you don't have to pay me later, but she has like, I'm gonna swear I haven't masters, but she's kicked ass. Like when they hired, I was like, thank you, Jesus, because like she calls, I'm sorry, but you'll text me and say this, like I have so much in my head right now. She's like, you need to come to this and here's the reason why. And I'm like, okay, because like I hustle like a 2-bit, but it's like, yeah, so thank you, girlfriend, because like.
Sure.
Yeah.
That's what we want to do together, right? Round of applause for all of us. Huzzah. We're here, we're showing up, we're doing the work.
Just one thing to think about, those of us that work in arts and culture, especially on the nonprofit side, we don't know where philanthropy is going to go over the next few years. I suspect, like we saw in the last 4 years, they'll continue rerouting money to other social services away from the arts. So we have to be a little bit more entrepreneurial. And I'll quote Eric. He has said that support for the sector is not going to come from the sector or the usual suspects. It's going to come from places where we have outcomes in, like education and like health. So this is an entrepreneurial way for you all to get more money, get more patronage, and not rely on philanthropy. So we're dreaming of a whole bunch of new ideas. I want to see arts being used as a mitigation tool in workers' comp and an employee assistance program. We're actually working on creating an arts benefit for employers program where employers can give their employees some money to engage in arts and culture as a creativity tool and as a wellness tool. So we're thinking these ways on how to integrate arts in all kinds of things. And it's going to be you all having to think that way too, but don't think about, 15,000 arts organizations, y'all. My money only goes so far. So we all going to have to be creative in how we are finding resources for the sector.
And Dean College is great for those that don't know. Like I started this, I'm like, they said, we want to do something with the sports teams. We want to get them involved with the arts. So they came to me, I'm like, all right, arts and athletes. So like, I have the whole football team doing potters. We didn't have the space, I was in the studio, but that's the thing, Dean College, like, and they're great. They want to partnership with people, small businesses downtown. They want to bring the arts.
All right. Oh, sorry. Go ahead, Emily.
One more thing, I promise, then we'll be quiet. But I think, to Michael's point too, I think solving both on the art side, but the mental health side too, there's so few resources. The wait lists are very long. We have to think creatively about how we're solving, mental health crises, how we're supporting, addiction and substance use disorders. And so I think that's also a huge piece, is just trying to think creatively about how we solve the problem. All these things already exist, right? Let's put money and energy towards connecting those, and that's really the goal. So, yeah.
Excellent. Well, everybody, oh, I'm sorry, go ahead.
I just wanted to.
Sure.
Because I'm here from Dane College.
Yay.
Yay.
Thank everybody for the shout outs and say, yes, we are looking for new ways to partner with Franklin.
Love to hear it.
Time there hasn't been that synergy and there is now. So please don't hesitate to reach out. I have a bunch of clients.
Amazing. So I was just going to say thank you all so much for coming this afternoon and asking the questions and being willing and open to participate in this initiative. And we have a few more minutes, so let's go all eat those cookies and have some coffee and have a few minutes to chit chat with one another. And all of the flyers have the QR codes and contact information too. So when you step out the door, there is another next step that you can follow up with. All right, round of applause for our speakers. Thank you, everyone.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.